It's an honor and privilege to be here. I think the punishment for showing up a little late was having to follow that talk. And there you go. That shows you about punctuality. So first I want to start off and say really what an honor and privilege is to be here. And I'm so excited to be in this room and so grateful that all of you are part of this organization and want to thank you for your service and for taking time away to be here. What I want to talk about today is the We Are SAGES effort that we've done as a society as a whole. Here are my disclosures. The other disclosure that sometimes I say here too is some of the things I talk about or can be a little bit sensitive or make people maybe feel a little bit uncomfortable. And I think that's okay because I'm a firm believer in growth and discomfort. And if everything was comfortable, then it was probably not worth it. So I always start off this talk with talking about what is the mission of our organization. And when you go on our website, this is what our mission says. It says the mission of the Society of American Gastrointestinal and Endoscopic Surgeons is to improve the quality of patient care through education, research, innovation, and leadership, principally in gastrointestinal and endoscopic surgery. And I think that this is a phenomenal mission and vision. However, we know that this has changed and sort of evolved over time. So when we look at who are we as an organization, we have about 6,000 members. And I mean, think about how broad that scope is. And I believe we're the second largest organization to the American College of Surgeons. Our meetings are very well attended, and we have a really high level engagement, or at least we hope that we do. And we have dedicated leadership and very loyal members. But there's more to come on that, because this is the perception that we had. And before we start getting into why we have this and why we're going to do this, I want to talk a little bit about diversity and what diversity is. A lot of people, when they think about diversity, they think about it in the context of the social justice. It's the right thing to do. We should be nice to people. We should include everybody. But it's really more than that. Diversity really gives us a bonus, an ability to be innovative, an ability to have a lens to see things with different perspectives. And it helps us avoid groupthink. These two books, if you don't have a chance to read them, if you have a chance, I would really read them. They're written by Scott Page. One is called The Difference. That one might be like a long trip to Malaysia type of flight book to read. It's very long, very dense, about 1,200 pages. But the second one is a little bit of a lighter version, and this one's called The Diversity Bonus. And what this book is it really shows in a mathematical way how including different lenses actually leads to better complex problem solving. And I can imagine in your roles and positions that complex problems, as we just heard, is something that can occur every day. And I think the talk that we just heard was a phenomenal example of this, about how that diversity in the room, not necessarily all high-ranking officers, but people with different experiences and came from different backgrounds, solved a really rare and very uncomfortable problem. And so what is diversity, right? Because often we talk about diversity and we're very prescriptive. We talk about men and women, we talk about race and ethnicity. And I think that's a very low level of diversity to think of. I think it's important, but I think when we talk about diversity, what we really need to think about is cognitive diversity. The different lenses people bring based on the different experiences they had growing up, the different experiences they've had even job-wise or regional-wise. And so when we think about this, it's really just not in that black and white version of race and gender and all these different things, but who we are as people and what all of our collective different experiences bring to the table. And it's important because it influences every single thing that we do. And most importantly, it impacts the way that we do things in healthcare. So first off, it impacts the way that we take care of our patients and patients' outcomes. There have been numerous studies to show gendered and different impacts that happen to our patients when we take care of them. I know there was a little bit of a controversial British Medical Journal thing that showed that patients that were taken care of by women physicians may have had lower mortality rates. Is that true or not? I think it's difficult to ascertain, but it certainly isn't a detriment to have women in the medical force. What about our workforce, right? There is a plethora of literature that shows that certain underrepresented minorities in different groups are scared or hesitant to come to hospitals due to years and years of mistrust. And we know that when we have concordant physician and patient pairs, that people feel more comfortable. People, when they come to a hospital and they see someone who looks like them, whether or not it's true, it gives an inner peace or an inner security that they're going to get taken care of in the right way. It also leads to cultural competence. When you have different people who you're working with and you learn different things, it helps you take care of patients in a better way. So I think it's really important as we think about our future workforce that we make sure that our workforce also looks like what our patients look like. What about healthcare policy? You know, if the people who are writing our policies don't look like the people who those policies are impacting, you can imagine that there's a really big mismatch. Has anybody seen ineffective policies or things that come down? Maybe I won't make you raise your hand in this room, it's probably not allowed, but things that kind of come down from the top and you're like, who thought of this? You know, I in a very base kind of example, it's kind of when you're in the operating room and you have administrators making rules of engagement for how the OR daily shuffle should look like, but they've never stepped foot in an OR. And because they don't have anybody on their board or on that decision-making panel that's actually ever been in an operating room per se, they make things that sound like a great idea, but when you go to implement them, don't make sense in workflow. So that's why it's really important when you're putting together teams, whether it's to design a new OR workflow or whether it's not to design how healthcare is administered, you have to have all representation on those groups, including the stakeholders, so you know how that's going to be seen. And finally, innovation. We can't move forward if we don't come together and think about what are those next steps, what do the next generation want? And if you don't include members of those generation, you're kind of making blind guesses and hoping that they're okay. And I think this is represented very well in another book, which is called What Got You Here Won't Get You There. And there are multiple phases when something starts up, right? You have your innovation phase where everybody's really excited, you're growing, you don't know if the ideas are going to pan out. Then they go into the improvement and finally the maturity. But then there's another phase, which is phase 4, which is reinventing your future, always trying to figure out what is that next best thing, where do we need to go next? And when you don't have diversity, I think this step is really hard. Do you guys remember Kodak? Anybody heard of Kodak film? I mean, never heard of it? Kodak film was the filmmaker, right? Like nobody else made film like Kodak, and they dominated the market. But then what happened? People stopped really using film as the digital age rose up. But there was a lot of groupthink in that company. And they were like, oh, we're always going to be a film company. People are always going to want film. Forget this digital age. Where's Kodak? Nowhere, right? Like it's really not a market dominating. I don't even think they're in the market barely anymore at all. And it's because the groupthink led to this. The desire to embrace the future and what that could look like because you're doing so well in the present. And so that led to the impetus of SAGES doing this. We're doing great as an organization. Our membership is great. People are engaged. Our meetings are well attended. But what's our next step? How do we stay relevant in this changing world? Who are we? Are we meeting the needs of all of our members? Do we have any blind spots that we don't know about that can maybe tank us at 5 years, 10 years, 15 years down the line? And how is our organization doing? And so we formed, and we were called the We Are SAGES Task Force. And we started by making a clear mission and vision. And our vision was to really foster innovation, which is the heart and the lifeblood of the society, through diversity and inclusivity. And the first thing we did was a climate survey. We took the mirror and we held it up and we said, okay, we need to know what we're not doing so well. And so in 2017, we started by administering a climate survey to our committee members. We have 800 committee members and I think 900 committees members next year. So it was a really nice representation of the organization. And it might have been a biased population, like people would be more likely to like SAGES, but I think in some ways that's good because that way, one, we know any negative results are probably truth. And two, people are more likely to respond if they're engaged because if you send out a big survey and 5% of people respond, it's not as helpful as if you get more engagement. So we ended up getting about a 52% response rate, which is pretty good for a survey response rate. The majority were male, the majority were white, identified as heterosexual and non-disabled. And I put these stats up there because everything I'm showing you is a little biased, right? Based on the population who responded. So we still have to take things with a grain of salt. So what did we found? We found that really everybody was pretty happy with the organization. Overall satisfaction was about between an 8 and a 9. So it seems like we were doing a pretty good job keeping people engaged. What we also saw, though, is that we did have people in our organization that considered leaving. And when we probed it a little bit deeper, they wanted to leave for organizations where they felt that maybe there was more leadership experience, or there's more collegiality, or there was more emphasis on the subject matter of their expertise. We also asked about people who wanted to move on to leadership roles. And the reason that I found this problematic was we have a biased sample of people on committees where you would think that the majority of them would want to advance through the organization and attain leadership roles. But almost 30% of people said that they didn't know or they weren't sure if they were going to go forward. I mean, I think you're starting to see that there's a little bit of a disconnect there. Why is that? And finally, when we asked if people had experienced bias in the organization, most people didn't. But you know what? In my opinion, an unacceptable amount of people did. And while it was under 10%, this is kind of one of those Six Sigma, it should be 0. And what we saw was that where this bias was coming from was really from around our leadership and colleagues. And so again, something to kind of deep dive and think about. So overall, we were doing pretty well, but we had clear blind spots that came out of this. One is advancement and participation. It became pretty clear, and I'm going to give you some quotes to kind of emphasize these themes, is that people didn't really know the pathway through advancement in the organization, how people moved up from committee to committee chair, to the board, to exec, and then further. 2 was this concept of identity and value, who are we? And then finally was diversity, and it was really interesting because what I had anticipated coming in with my own biases is would be a lot of gendered and race ethnicity comments on diversity, but it wasn't. It was a lot of generational, extremes of age, older and younger, and where they fit into the society, practice types, community versus academic, and then non-surgeon and surgical subspecialties that felt like they wanted to be engaged but didn't know if they had a home here. And that was pretty eye-opening for me to see as well. So I want to give you just some quotes as samples to these different themes, because I think when you read people's words, it gives you a much deeper and richer understanding. So we talk about advancement. SAGES leadership seems very hard to break into with the same people and their residence fellows getting advanced. These hurt to read, but I think in an effort for transparency, we have to put this out there, to read them. My disappointment is that promotion seems to be linked to connections rather than enthusiasm and efforts. Not everybody is given the same chance for promotion. Talking about identity and value. Because minimally invasive surgery techniques are now the norm, I am not sure where SAGES fits in within general surgery. Could SAGES be rolled into the ACS is the question I've asked myself. I am not sure of the answer of that. Next one. As an MIS surgeon, I feel almost obligated to be a SAGES member, but honestly, other than the SAGES annual meeting and surgical endoscopy, I'm not sure what else my membership is good for. And finally, on diversity. Recently received an email for a leadership day at SAGES. There was only one person of color as a speaker. For a day with a presentation on unconscious bias, there is a problem with leadership only inviting Caucasian speakers. And then sometimes wish there was more mentoring opportunity. Would also like to see more women in visible roles as mentors. I can tell you those comments were really hurtful, and they hurt to read, but they were good to read, and they made everybody uncomfortable, and everybody read these. I pulled every single comment, we put them into a Word document and sent it to every member of the executive committee and every member of the board, because everybody needed to read this. We all needed to understand what was going on so that we could make changes that were important, that are going to help our society be sustainable. So what are we doing? Well, this has led to tremendous change. One of the things that we've done is to ensure our branding or our websites or the materials that come out from the organization are representative of our members. Anybody see the old covers of surgical texts, which are the 3 white male surgeons operating? We can't do that anymore. And we have to be very conscientious of our image and what we're putting out there. We have increased awareness efforts of how to get involved, how to get onto committees, how to sort of start advancing through the organizations. We've started collaboration with other organizations. One of the ones I'm most proud of is a collaboration we have with the Society of University Surgeons and the Society of Black Academic Surgeons, where we have promoted 2 underrepresented minorities, and we've committed each year to put them through a leadership development program, which is a longitudinal program with coaching and leadership opportunities. SAGES meetings, there's booths, pins, we're doing a rebranding. You might go around, you're gonna see our new branding, which has the 6 core values of our organization, and it'll be in the presidential talks and on big banners kind of everywhere that you go. And then we've also done diversity and inclusivity training for all SAGES leaders, so everybody on the board and our exec was mandated to go through unconscious bias training. Mid and longer term actions, structured and transparent processes. One of the things we're working on right now is what's called a SAGES CV. This will be something that comes up on your profile page. You'll be able to see everything you've done very transparently through the organization, your role in paper reviews, abstract reviews, and most importantly, you'll be able to self-designate areas of your expertise so that when we're looking for speakers, we'll have at least a repository and a pool to be able to pull from. Dr. Pryor in her presidency has talked about starting a leadership development program, which will hopefully be a longitudinal opportunity to give people career development skills as well as leadership skills. Ensuring diverse session chairs and speakers. If you go around the meeting and you look at all these different sessions, you're not going to see males. You're not going to see a lack of diversity. There was so much intentionality in putting the meeting together for the last 2 years. It's been absolutely incredible, and I think it's been a tremendous job by both the presidents and all the program directors. And really ensuring inclusion of all groups, that when we're doing things that we're keeping people in mind that have different needs. And so finally, I think this work is really exciting. I think we're just in the infancy. I think there is so much more to do, and we're really excited about it. But if you leave with one message today, diversity is more than the right thing to do. It's really what's going to keep us on the forefront, not just as an organization, but as a society and everything that we do. We can only be better when we put together people who have different experiences and can come at problems in different ways and make more robust solutions. Overall, I think this organization is doing great. I love SAGES. That's my bias, and I have to put it out there. But I think we can always do better, like with anything else. And we have great strategies, but we can always use more. So if anybody has any ideas in this room, want to contribute, want to participate on this task force, I'm happy to have you. I would love to have you. And just please find me at the end of the presentation or outside, or send me an email. So I'll say thank you, and I'm happy to take, I guess, any questions.